Hi guys, I'm Danny West, and you're back with another episode of the SOAPBOX, your patient education station. And this week we are talking about the T-spine, or the thoracic spine, or as I like to call it, the poor forgotten spine, okay? So why should we care about the T-spine? Only because it's usually the missing piece for everything. So if you have low back pain, if you have neck issues, if you have shoulder issues, if you have hip flexor issues, if you have stomach issues, I actually find you can trace a lot of that back to a restricted T-spine. And in fact, even more importantly, breathing issues. And if you guys are interested in breathing physio, please check out my colleague Jess DeMars. She does a lot of work with breathing. Okay, so we're talking about the T-spine. It is the middle 12 vertebrae in your spine. And it gets quite stiff because unfortunately in life these days we're here. We're hunched forward, so it gets really stiff in this position. Chin jets forward and creates a lot of neck tension. So we want to make sure to keep this loosey-goosey, right? Motion is lotion. So my number one thing that I use to kind of like start to loosen up the T-spine is called the twist test. And I have renamed this, but I did not make this up. This is a technique that I learned from Urson Religioso, okay? He has a blog called The Modern Manual Therapist and the Eclectic Approach. So this was something I learned from him in one of his courses, and I just coined the term the twist test, okay? So I use it as an assessment tool and also as a treatment tool for the upper back. So you're gonna start seated in a chair, arms crossed over the chest. You're gonna twist to the right as far as you can, and then you're gonna twist to the left. And just kind of notice, even for yourself, or if you're the one assessing your patient, which way looks sticky, or maybe there's a way that feels restricted to them if you can't quite tell. So to the right, I can get pretty far. To the left, I'm definitely a little stiff, okay? And the T-spine needs to have a good amount of rotation as well as extension for the shoulder, for the low back, for the neck, for the ribs to move properly around it, okay? So one way to kind of quickly restore T-spine range of motion is a twist test. So whichever way you're sticky, so I'm sticky left, I'm going to twist as fast as I can to the left 15 times. So you'd have the hands behind the head and they're gonna twist. Again, feet planted so hips are stable. And we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then immediately retest, right? Test, retest, test, retest. So they cross arms over their chest, go to the right, and then go to the left. And you can see dramatic improvement in just that 15 seconds, just from me going to the left. So that's one I really like. And again, I would have patients maybe do this on the hour. It's like hitting the reset button on your upper back. I wouldn't do it if they're in extreme pain, right? If like a rib is not moving well and you get them to rotate. If they're wincing, it's probably not appropriate. But for me, like I just feel restricted, a little stiff one way. So again, make sure that they can do it in clinic properly, pain-free, and then have them kind of do that on their own. So that's a great one from Dr. Urson, so thank you for that. And then the second thing is extensions over the foam roller. And the third one is arm circles. And I'm gonna demo those two for you on the floor right now. All right, so for this first one, it's T-spine extensions over the foam roller. And I'm gonna pick 3 different spots to facilitate extension at. So start, ladies, I would start at the bra strap, and for men, kind of just below the shoulder blades. Hands behind the head, and extend back, and up, and extend, Do a couple sets here. And one more spot, closer to the neck. And again, a couple sets there, okay? You can also roll the upper back. I just like being very specific about it. So extensions, and then the final one would be arm circles, okay? Which I love, again, maybe for more of a gentle T-spine rotation. So I lay on my side, knees stacked, shoulders stacked, start to circle the arm up overhead, try to open up the shoulder blade to the floor, and then come back around. Keeping the knees stacked, I'm not letting them shear. So again, it's kind of, you can block the hip, really trying to facilitate rotation of the upper back, and then you can go the other way. Okay? I would do both sides, maybe 10 in one direction, 10 in the other direction. Really, again, with the focus on the rib cage and the twist of the upper back, not just moving the shoulder. Because again, if the upper back can move freer, it will free up the range of motion at the neck, the lumbar, the hip, and the shoulder, and the rib cage, okay? So it tends to be the forgotten spine, but those are kind of my top 3 go-tos that I'll try with people. Again, nothing should pinch or be painful. You're trying to facilitate gentle movement. So the twist test is not for everyone, but I do use it in clinic even as an assessment tool. And then whether I prescribe it as a home thing or not, depends on how they perform it in clinic, okay? That one's from Dr. E. And these 2 are taken from just physio experience and also some Pilates work. So yeah, enjoy, and please do not forget about the upper back and making sure you kind of maintain shoulders back and prevent any chin pokey posture, okay? Keep those T-spines mobile, motion is lotion, and we'll see you next time on the Soapbox. Thanks, guys.